So impetigo is a highly contagious bacterial infection of the skin caused by the beta hemolytic streptococci or Staphylococcus aureus or both. So as I told you, it is highly contagious bacterial skin infection that affect the infant and children, right? So most common infection in childhood because of bacteria, particularly beta hemolytic streptococci or Staphylococcus aureus. Impetigo can occur because of poor hygiene. It can be primary infection or occur secondarily at the site that has been injured or sustained an insect bite, or at the site that was originally a rash, such as atopic dermatitis or poison ivy or poison oak. So the basic pathology, the infection of the epidermis by the bacteria, we call Streptococci or Staphylococcus aureus. The most common site of infection are face, around the mouth, and hand, neck, or extremities. So most common site around the mouth, yellow or honey cast lesion, especially in the face. So the lesion begins as a vesicles or pustules surrounded by edema and redness. So the lesion progresses to an exudative or casting stage. So in this picture, so we can see this is the exudate, but in this picture we can see the cast. So vesicles then rupture, leaving the honey cast that cover the unulcerated base. So what are the sign symptoms? The lesion, usually yellow or honey casted, erythema, pruritus or itchy, burning sensation, and secondary lymph node involvement. So in this picture, we can see impetigo contagiosa. And then what are the intervention? Before to go intervention, I want to tell you how we diagnose it. It's clinical presentation, culture of the lesion. So contact isolation is most important. Use standard precursor and implement agency-specific isolation protocol for hospitalized child. Or strictly hygiene practice are important because it is highly contagious condition. Also listen to dry by ear exposure. Assist the child with a daily bathing with the antibacterial soap as prescribed. Apply the warm saline or other prescribed compresses to the lesion 2 or 3 times a day, followed by a mild soap and water to remove the cast and allow for healing. What else? Apply the topical antibiotics ointment with a clean or sterile cotton swab without touching the tube, opening with the finger or skin, and instruct the parents in ointment and swab use. The infections is still communicate for 48 hours beyond the initiations of antibiotic treatment. So topical antibiotics like mupirocin is the drug of choice. Sometimes systemic antibiotics work. So admin oral antibiotics or systemic antibiotics, which may be prescribed if there is no response to topical antibiotics treatment. It is extremely important and completely with the prescribed antibiotics regime because secondary infections such as glomerulonephritis may result in the infection agents is of the streptococcal type that can affect the nephron. So if a baby have impetigo, an organism is streptococci, if baby is not get a treatment or maltreated or maltreated, this infection can contaminate to kidney and formation glomerulonephritis. Inflammation of the glomerule, chronic inflammation, it can lead to kidney failure. So what else? Apply and instruct the parents in the use of emollient such as prescribed or prevent skin cracking. Educate instructions to the parents in method of preventing the spread of infection, especially careful hand washing. Inform parents that the child needs to use separate towel, linen, or dishes. So if the baby touch the lesion and itchy the other side or scratch to the other part of the body, it should be contaminated. So inform parents that all linen and cloth used by the child should be washed with a detergent in hot water separately from linen and clothing of other household members. So let me recap what are the nursing intervention. Avoid other children during active outbreaks or cover the sore with a bandage to prevent spread and wash the hand, linen, cloth that have that has come in contact with infected fluid.